A very good afternoon to you. Before we start with anything, I would like to know your name as well as it's been how many years since you've been practicing.
My name is Dr. Satyajeet Purnapatre. I am from Chalisgaon, that is North Maharashtra, Jalgaon district, and I am there in urology practice since 2006.
Okay, so we're gonna have the topic for BPH, and the first question over to you. So, what lifestyle modification would you recommend for BPH patient to have a comfortable life?
Precisely nothing specific for prostate. As such, you need to have a good exercise, healthy eating habits, and usually the prostate problem starts at the age of 50 and onwards. So in those age group, I really wish people to drink less, smoke less, or if at all not, then it's fine and good. But per se, BPH does not. Most lifestyle modification does not affect BPH as such.
Okay, so now that you have spoken about age, so lifestyle modification for the age group of 40 to 50 to avoid BPH, what are the precautions they must have?
That's what I told right now. Per se, lifestyle modification and your prostate size does not matter at all. As long as you can have a healthy and good vegetable food or a balanced diet, I can say. That would be really helpful. Otherwise, nothing specific.
Okay, heading towards the next one. What, according to you, is the best treatment for BPH?
It's a real tough question in the sense you really cannot categorize the treatment for BPH. It depends on what type of patients I get or what symptoms patient has. Suppose like patient if he's in really retention of urine, surgery would be the best. But yes, as long as the patient is manageable with medications are the first line of treatment. Yes.
Okay. Medication, all right. Okay, as we spoke about surgery, so when does surgical intervention become necessary? Can it be avoided?
Yes, it can be avoided, but there are 5 clear-cut indications when the patient has to go under surgery. One is, of course, once I told you, acute retention of urine. Second thing is because of the prostate, patient has a continuous bleeding or a hematuria. Third is a patient who has a chronic retention and that leads to a stone formation. Fourth is a chronic retention with a bilateral renal damage or a kidney hydronephrosis. And fifth and the last is the foremost indication is failure of medical treatment. That means patient has tried the medicine, but that has not worked with him.
Okay, heading towards the last question over to you. What are the complications that could develop if BPH is not diagnosed early on? And also, can you share few instances that you have come across during your practice? Over to you.
Yes, regarding the second part of the questions, I can share many incidences. Usually I practice in a village area or a remote place. So there is a lack of you can say awareness about this BPH. So usually patients who come to me are usually in the last stage of their disease where they already come with a renal failure and or maybe a stone or maybe other complications related to prostate. So there could be a number of stories to share. But again, the first part of your last question, what complications patients can get? Yes, kidney failure is one big complication. Second thing is stone formation. Third thing is due to the renal failure, there can be other complications due to the other organs also.
So that's all. Well, thank you for your valuable time. It was nice talking to you, sir. Have a great day ahead.